Our winter plan. Following the success of last year's winter plan, we have listened to staff to find out what worked well, enabling us to establish a winter plan for this year. Last year's successes. Since last winter, we have expanded the emergency department medical team to 16 consultants and 16 registrars. Opened our new urgent and emergency care center, including the new emergency department, acute medical unit, and the co-located urgent treatment center and pediatric assessment unit. Increased the consultant input for general surgical emergency patients. Opened 27 medical beds on Ward 14, and 15 surgical beds on Ward 9. A total of 21 medical beds were also opened on Ward 5 as part of our winter plan. Many of these initiatives will enable us to deliver comparatively timely access to urgent and emergency care. We are consistently amongst the top-performing trusts within the West Midlands for ambulance handovers. This year's challenges. The challenges we are looking to address through this year's winter plan include an increased number of patients, the cost of living crisis, challenges at neighbouring trusts, which can result in us providing support to ensure patients across the Black Country get the urgent and emergency care they need. Our plan. We are addressing these challenges by increasing the number of patient beds, growing our workforce, expediting hospital discharge, expanding new services in the community, helping people to get the right care at the right time via NHS 111. Support for the medical division. Opening the new ambulatory emergency care unit, located in our former emergency department, by December 2023. Inpatient ward rounds on a Sunday. Extending the opening hours of the ambulatory emergency care unit. Maintaining overnight opening hours at the urgent treatment centre overnight. Extending frailty unit cover. Basing an acute medicine consultant in the emergency department. Extending the use of the ED referral tool, EARL, to the Care Navigation Centre, to support access to urgent and emergency care pathways away from the emergency department. Support for the surgical division. Increasing emergency surgical and trauma capacity. Improving discharge planning and allocation of beds. Providing additional consultant support. Support for the community division. Continuing to provide expanded staffing for discharge teams and community-based rapid response teams, maintaining low levels of medically fit patients within hospital. Enhancing support for the hospital avoidance team and speeding up hospital discharge. Support for women's, children's, and clinical support services. Providing additional nursing and medical support to expand assessment and bed spaces for pediatric patients. Extending pharmacy working hours. Offering additional CT scans at periods of peak demand. Support for corporate services. Additional norovirus, flu, and COVID testing. Additional access to infection prevention and control, and site practitioners. We know that winter is our most challenging time. Thank you for your ongoing commitment to our patients, and your support in delivering many of the initiatives within our winter plan. There is also lots of support and help available to you. You can contact the Health and Wellbeing team via phone 01922 656 020, mobile 07790 981 886, email wht.health.wellbeing@nhs.net. You can also view the full staff health and wellbeing offer by visiting the link or scanning the QR code shown on screen.